here at Livingston, and that is take care of patients. You are amazing professionals. You know what you're doing. You're caring, smart, talented. And none of that changes when we change to a new EMR. So just remember, when you're out there caring for your patients, that's what you do. If you hit a speed bump, or there's a question, or something that comes up with Care Efficient, don't let it stop you from what you do best. Know that we will be here to help you. We will get through this, and everything will be great. In 6 months from now, the product that you're looking at in Care Efficient will change. This is an ever-evolving EMR. We are currently customizing it specifically to Livingston. So as you navigate through, when you see something that could be done better, or maybe phrased a little differently, or a redundancy, perhaps it's asking you the same question twice, know that there are enhancements that are being made throughout this rollout and will continue to be made to make this product exactly as we want it, so that it will increase the speed of your documentation, it will be clear, and it will be compliant. So with that, I'm going to pass over the mic to Jamie, and she's going to get us started.
Okay, so the first thing I just want to show everybody, which I'm sure everyone knows already, but there's a little nuance to this. So when you're logging in, you put in our code, and for most of us, we have our stuff saved. So I just hit this and up it comes, you know, mine populates on its own. But let's say for some reason you didn't have that saved, or it's been a while since you went into it. Sometimes you have to enter your username, and some people forget that it's your first initial, last name, but you have to include @lmvna.org. So I've had a couple of people get frustrated that they're trying to log in and they're using their first initial, last name, but forgetting the @lmvna.org. So that's a little thing, but I just wanted to remind people because it has caused a couple of people some frustration. And part of what we're doing on today's call is pointing out little things that have caused frustration and trying to clear up some of those types of things. So that will be addressing a lot of little things. I want everyone to think about this and know that this is going to happen, that there will be no double charting in Care Efficient. So if you put something in one place, you don't have to put it in another. At this moment, though, our service notes or forms, you know, our start of care evaluation notes, they do have double charting in there. You do not currently need to double chart though. If it is in one place, do not put it in another. The service note is being, like Tree said, customized for LMVNA. There's probably maybe 15-ish changes that are going to happen in the start of care service note. And then there'll be more in your daily revisit notes. It will be, I believe, at the end of the day, well, not the end of today, but that'd be awesome. But in the next couple of weeks, that service note will be one that is perfected and will not have areas that you need to double chart in. So I'm going to show you a couple examples right now where you should chart instead of double charting. So I'm going to pull up this patient here. This patient's open. I'm going to go to Edit Page Oasis Integrated Assessment. I think I am. Yeah. Okay, there it is. So in here, there's a couple of places right now in the service note where it's asking for a narrative about certain items, and then it asks it again. So it'll ask patient's past medical history, and then it will ask you it again in another spot. So like I said, I don't want you having to do it in two different places. So for example, on page 11, which is not numbered, 1, 2, 3, 4. Okay. So in this section here, on your start of care visit, you have a page. Oh wait, going to the wrong spot. Sorry. I have it numbered. Why did I'll go backwards because, sorry about that. I'm gonna show you it, but since we're here, I'll show you this section first since I'm already here. This here question is an Oasis question. M1033, risk of hospitalization. You see that it's an Oasis because it has the M and the number, and you have to pick choices. This is a reminder, anything that has a square box has multiple answers that can be chosen. If it is a circle, like a radio dial, you can only choose one. So this question is an Oasis question, and it lives in the Oasis and it cannot be extracted. But this is truly the only place where right now you do need to double chart, because you need to fill in this here. And then what we need to go on to the Oasis is this one here. You see how it says locator risk, go on to the 45. This here says locator, risk for hospitalization. This is truly the only place that you must double chart, because this here flows onto the 485. It can't pull it from the Oasis. It can only pull it from an assessment question. Any area when you're going through your starter care that has LOC in front of it must have an answer. It's called a hard stop. If you try to get your assessment or your service note to an approved status, you will not be able to do so if you do not have the locator questions answered. So when there's a situation of double charting, which I'm going to show you, choose the locator box to answer that question. Don't choose the area in the service note that's asking you. So for example, do you have a question, Philip?
Oh, no, I'm good.
Okay. Okay. Go to history, present condition. Okay, so in this area, and you guys can see, here's the headers of all the titles of every page that you have in your Oasis, or in your service note. So if you're looking for something, so I wrote history of present condition. Okay, so this here is an example I wanted to show you. Do not chart in here. It doesn't say locator. And these questions are asked of you later. And there is, Darylyn, I know you had some frustration yesterday with this. So I hope this is music to your ears. I know my voice is not.
Thought I was going crazy.
Yeah, so that's why I wanted to point this out. And because we really don't want you having to say the same thing twice. And I'm sorry that the way that this came out at first had this, but like I said, it will be fixed. So where you do need to chart it though, is in this admission. Okay, here, see all these things that say locator. These things will flow onto the 485. These are conditions of participation. And there are lots of boxes that kind of replicate, as an example, the one that I just showed you. See, these have radio dials. If you don't answer something in here, you will get a hard stop because this needs to flow onto the 485. I'll show you the next page has more of them. Patient caregiver assessment. You want to put in the patient representative's name and number. This goes on to the 45 and the doctor will see this. This here is an example of like narrative boxes that they're asking for information that they asked for earlier. So just make sure you put it in LOC. The patient's strengths, the patient's preferences to include requested schedules, patient family goals. There's going to be a box added to this that says patient's acceptable pain level. And we want you to answer that because then that will go on the 485 for the doctor to see what the patient's pain goal is. And then the next area I was going to show you is admission rock summary. Okay, prognosis, again, it has a locator box, so you want to make sure you answer that. Okay, the last part of this that I wanted to show you, where you really, so this is where you want to do, it's titled admission rock summary, and in here there are some locators, see, LOC, homebound status. This is what you want to think of as your clinical note. So remember how in McKesson we did our Oasis with the integrated assessment and then we had a clinical note. This here is where you want to chart. This 77-year-old male went to the hospital for blah, 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 returned home. Leslie and Delia and Jeannie worked on this admission rock summary. where we'll put in here the prior level of function. That will be added to this note. And I want to point out this area here where it says skilled intervention procedures provide this visit, not detailed earlier in this assessment. For those of you who have done a starter care, you'll see under each organ or body system evaluation, there's a note. I'll show you. Like, let's go to GUGI. Or here. Yeah, okay. So in this section, after you answer it, every section says documentation, teaching. After you go through an area of the body that you assess, there will be a box that says documentation, teaching. There will be an additional box under here that says caregiver, patient caregiver response. When you go through your system and you teach on something, type it here and put the patient's response. If you do that as you go through the body systems, when you get why we added, so some enhancements have already occurred. This is one of them, where it says, let me have it get there, not detailed earlier in this assessment. So if you wrote what you taught to the patient on the GUGI system and their response, don't retype it in here. It's not necessary. If you decide that you are a clinician who likes to put everything all in one spot and not do it after the body system, you can put it in this area. You won't get a hard stop. You'll just need to have it documented in one place. So does that, for the people sitting here, does that kind of clear up? Because we have had some people call in and say, you know, where do you want me to put this information? So that's how that works. So please don't feel like you have to put it in both sections.
I'm just gonna add a little note on these narrative boxes. This is where you're free texting and typing, and it looks a little bit small. So on your tablets or your Chromebook or wherever you're documenting, when you see a box like this, in the bottom right corner, when there are little lines, two little lines, if you put your finger or your stylus or your cursor on there, you can drag open the box. This allows you to have bigger space so that you can see what you are typing. I want to warn you though, that after 7 minutes, this box closes back up. It's an auto save function. You have not lost any of your documentation, but if you step away from your computer and 7 minutes later you come back and it's back to this size, it's only because internally there's a 7-minute window where the computer auto saves everything you've typed so you don't lose anything you've written. All you have to do is go back to your little lines here and drag it open again and you can see everything.
In this area is also the talk to text function. So on your tablets, when you use the tablet's keyboard, not the added keyboard, you use that, you'll see the mic. And if you tap on the mic on the Samsung tablet, you can speak into your tablet and it will populate, you know, talk to text will fill these boxes, which I think is a really nice function. I wanted to show you on the risk for hospitalization, the one that is not the Oasis one, but the locator one. This little box underneath here where it says risk for hospitalization, add to plan of care with appropriate interventions, always mark yes. I'm asking Care Efficient if they can always have this marked as a yes, or just make it flow, because there's never a time that we don't want this to flow onto the 485. So I'm seeking a little clarification why this box is here. Because if you miss this, then it doesn't flow on. So just wanted to point that out, this little box here to say yes on.
Jamie, on the top right of this screen where it says review section in green, is that?
That's because this is in QA review. I'm going to show you. This actual assessment is in QA review. I did it this way so I could show you. And then I'm going to be able to show you again with a patient of Leslie so that we're clear on how that works. Okay, so Another little tidbit kind of information is your initial visit frequency. So when you call into your PAS and they help you with getting the 485 set up with and putting your visit frequency on the calendar, please be mindful of the number of visits that you think that you want, because once we plot those on the 485, it's difficult to change. I'm not saying it's impossible, but it really would be best to, talk it through with the PAS and just give it that extra minute of thought of, is this really what I want? Because once it gets plotted, it's kind of hard to undo it. We'd have to write like another order. Like I said, we can fix it, but it would be best to get it right the first time if possible. The other little bit of information is about hospitalizations. For this week, when you discover that a patient is gone to the emergency room and you're not sure if they're hospitalized or if they have been hospitalized, call into myself or Leslie or Jeannie or Delia or Cheryl or Antonio, and let them have that information, and we will do it on our side, what needs to happen in Care Efficient. We're going to do another Zoom meeting next week, and we'll address the full process with you guys then. But for right now, we'll take care of it. But you must please click your team members when you discover this, because if you send me the click, I might not get to doing this process till an hour later. But you want your immediate team members who could possibly have visits to see the patient on that day to be aware. So, so send me or those people a click, send your team members a click, and then we will, like I said, do on our end what needs to happen. In the click that you send, let's say to me, please say what hospital the patient went to and why they went, so that I can, or Leslie can, or whoever you tell this information to, can complete what needs to be completed. We may have to reach out to you a little bit later for some additional information, but if you can get us started that way, that would be really great. I'm going to show you messaging, but I want to make sure I covered the little tidbits. The area right now that's in your starter care assessment under influenza, well, first of all, right now, none of the patients have, you mark no, so it's not as important. But this here section, we are having removed, so don't worry. This influenza risk assessment, you're not going to have to answer, and it's not going to be there. I'm just trying to show you some of the positives. And when you get near the end of the starter care and it has that educational assessment questions, those are being edited. So there's lots of edits that are happening in your service note. Now this starter care service note has already been to an approved status, and the clinician got back from the PAS a note to make corrections. I'm going to show you part of that, and then I'm also going to show you it from the beginning of how you'll see it. But I'm in this service note, and I have changes that I need to make per my PAS who sent them to me. I'm going to see those here with a red line. It says ADLs, IDLs, response needed. So that was what the PAS sent to me. So I'm going to click on that. It's going to take me to that spot. And it says over here, review section. And that's where I'm going to see the note that the PAS sent me. I'm going to click on it. And it says to me, 1800 should be a 0, 1810 should be a 0. Please edit, thank you. So I would, I'm going to move that out of the way. I'm going to go back to here. Oh, I have to close it, sorry. And I'm going to make my edit. Oops. Make the edit. And then I have to go to the note, and I have to add a response and say completed. Save. Okay, now I'm going to close this. And let's say that was all I did, and I wanted to get it to approved again. Watch what will happen. It won't let me approve it because I still have another response that needs to occur. I need to do something in the medications. So I can't click on here. It won't take me to it. But if I go here, I see that it says response needed. So now it will take me to that page. And I will review the section. It's going to tell me what I need to do. And 2030 should be a 3. Please edit. Patient has injectable medications. So I'm going to go to 2030. I'm going to mark it a 3. And then I have to go to review section and say add response, edit made. And then I'm going to save it and close. Now, when I want to get to the approved status, my service note back to the approved status, when I go to approve, I believe it's going to let me because I have everything else done. Good. So now that service note is in approved status. I'm going to show you another case of Leslie will sign on and be the clinician, and she will show you how she knows that she needs to do this. But before I get to that, I just want to make sure that that we covered the things I'm supposed to cover. Yeah. Okay, if you are doing your service note and you got it to an approved status, the service note won't let you go back in there unless it gets into a incomplete status. So if you need that, like you think it's something like, oh, I wish I remembered to do that or add that, you can call a supervisor or Leslie or me, and we can unlock. Oh yeah, that's a good idea. Leslie, you start signing in as you. And we can mark your service note as incomplete, and that will make it that you can then go in and make some edits to it if you need to before you get your QA review. On Medicare patients, do a start of care today and the patient has Medicare, it must get to an approved status by tomorrow morning. The approved status makes it that visit can be verified, and a visit needs to be verified so that we could drop what's called our wrap. Remember on how you get those notes to make sure you complete your time in and time out on a Medicare patient? It's the same thing, but now the note needs to be in an approved status so that we can drop the wrap. On a non-Medicare starter care, you'll have to the following day to get it to an approved status. Approved then makes it that it can be verified that you can be paid for your visit and that billing can do what they need to do.
Jamie,
Yes?
I thought when I hit approved, it made me sign it.
Well, you do. This one didn't because it already had been signed.
Okay.
This was in QA review. You are correct that when you're doing it the first time and you need to get it, when you get approved, then you do need to, wait, no, you don't need to sign it. I'm sorry. Sign it? No, I was thinking the 45. As a clinician, you don't sign your service note. You have to put in the patient, the time in, the time out, and the signature for the patient called paper, but you don't need to sign it
Okay.
at that stage.
When we do that, does it automatically send a note to the PAS, or do we need to send?
So I'm glad you brought that up because that's what Leslie's going to show you. When you get your starter care service note to an approved status, you do not need to send the PAS a note that it's ready for review. You have QA on yours, don't you? Okay,
sure.
show them that. So when you guys get it to approved, the PAS's process is to be looking here all the time in QA review. So this is the role that the PAS has. They go in, if let's say Leanne is your PAS, Darlene, she's going to go to Home Health VIN. She'll sort it by starter cares and by approved. Like Rick It's,
Yeah, up
Yeah.
there.
Perfect.
So you can,
so these are all the starter cares in care efficient right now that are in VIN, the Ventura area, that were done by a physical therapist that are in an approved status. Some are locked and some are open, and that need the QA done. Where it says QA and response incomplete, this is stuff for the PAS person. You guys, I don't even think you can open this function on your tablet. But this just means that you don't, it's one step you don't have to do to let your PAS know that it's done. They'll be looking here. So that's one less thing you have to do is let them know. Then when you do what you need to do, but we're going to show you how you know that they have done their review. Leslie's going to show you that. So Leslie did a start yesterday. I did the PAS part of it. And how Leslie's gonna know that that's done, this is where you guys go as clinicians. This area here called Unread Messages. So Leslie's gonna click on that. And see how it says Service Note Review in red? That's what you guys will see on your, any service note that QA has done. Currently, we're only gonna do like we've done before, starts, rocks, research, and discharges. Your revisits will not have a QA review. Okay, so now,
okay, you guys, so I know that I did this. I sent it to my PAS, Jamie. Who's Jamie this day? She sent this message to me in the messages area, tells you the name of the patient, the start of care date. You click on this red kind of hyperlink. And voila, you're here. You just go to your start of care service note. It's now back in the edit status. You go into it.
and if you notice in the status area, it said QA review. So one, you know it's your start of care, but two, it will say the QA review.
You want me to go back?
No, it's
Okay.
okay.
Now, to know what you need to fix, you can click approve. And you'll see, okay, looks like I've got two things to do. Like Jamie said earlier, the way you find it, go up to your change section menu, and you're looking for things in red. See, there they are. They jump out at you. You get to click on it.
Can I interrupt for 1 second?
Sure.
I showed that approved status just to show you that I couldn't get there. But when you know that you're in QA review, the easiest thing to do would be what Leslie did, was go up to that change section, because they're gonna be in red. Now, the
Yeah.
tablet is not showing the different colors right now. So when you're in a tablet and you go to that section, it won't show up in red. It will just, but it will show with response needed with those asterisks next to it. So that's how it's gonna really kind of stand out to you right now. IT's working and care efficient's working. I'm not sure who's hopefully gonna problem solve this. But you'll definitely see how Leslie's is in black, response needed. That's what you'll see. So
Alright.
then you go to the review section. And this is the note that Leslie received from the PAS.
And if the message looks like it fills the space, make sure you hit this magnifying glass, because a clinician earlier this morning, Philip, there was more there than you realized. Okay, so what do I need to do? Edit 1820 to 1 and 1860 to 3. 1821. Whoops, I don't know why it's so jumpy. 1820 to 1 and 1860 to 3. I intentionally made mistakes so we could see this.
Because otherwise Leslie's perfect.
That is not where I was going.
Your mistakes are perfect.
Exactly.
Killing me.
So you do need to do this done.
Or completed, whatever. lingo.
Yeah, but you have to put in a response. So that's another little enhancement we're asking
The
for.
other piece too is, if you'll notice on the right side of the screen, review section used to be red. Now that she's completed everything on this page, it's turned to
Right
green.
here, this is. green.
Again, if you're having trouble on your tablet seeing these colors, You can do this on your Chromebook, you can do this on your home computer, a computer in the office, and you will see all of those different colors here in this change section, the green and the red.
So now I'm in meds, review section. 22 should be a, 2020 should be a 2. Almost like you gotta wait a second for it to reload. All right, 2022. Review. Add response.
And while Leslie's doing this, she's navigating around using a mouse. As you navigate in your tablet, you have arrow keys, you have a stylus, it's a touch screen, you can even use your finger. You will be receiving a wireless mouse to help you navigate around your tablet and also with the scrolling functions within inside Care Efficient. There are some challenges scrolling inside the meds, for example. Those mice will be, I never knew we were happy to have mice arrive, but they will be coming at the end of the week, early next week. IT will be reaching out to each one of you to make sure you get your mouse, and that will help you with navigating around on your tablet.
The cars are gonna start looking like cop cars, gonna have screens all over it.
Yeah, and then I hit approve
Oh, can you, okay,
and it sends it back to QA.
right. I meant to show you guys one more thing, which I'll show you quickly, and then we have some other things to show you.
It's still going, it's doing this.
Right. I can stay logged on as you, it's fine.
Okay,
Something that, because right now the PAS don't have their scribe role, how you guys are used to calling in and giving them information, they could populate your service note, and they cannot do that right now. Care Efficient is putting that enhancement in. We're not exactly sure when it will be ready, but it will be coming. But something that could save you guys a drop of time in your QA review is, I'm gonna go back to this patient. Say. Marking. This analyze button. So I want to point out to you guys, before you're going to get to the approved status and send it to your PAS, if you click on the analyze button, this is something that's going to show you inconsistencies in your assessment. And this is what the PAS looks for, and then they're going to send you it in a note. If you do this yourself beforehand, there's going to be that many less notes from PAS. And they can, when they do their review, they can mark QA done, and then you wouldn't get a note. It would just be that everything was done and you don't need to go back in it. So that would cut down some time. I'm asking for an enhancement on these ones. These are the ones I'd like you to look at where it says inconsistency flag, because that's the type of thing that the PAS looks at. So for example, 1820, and this one's marked 1. And the GG, which is lower body dressing, is marked 2, substantial assistance is needed. So remember, a 1 is saying that the patient can dress without assistance. Yet on the GG, we're saying substantial maximal assistance is needed. So that's an inconsistency. So the PAS could send you that note, please make the edit to this or to that. You could see another inconsistency. Lower body dressing again is a 1. The GG for self-care, upper body dressing is a 1, and the GG is a 2. So I'm asking if they can change the inconsistency flag to a different color. Reds are fatal flaws that need to be fixed before we could transmit to CMS, but all the others are the same color. So like readmission risk audit, I'm not sure that's something that a clinician's going to pay much attention to, or the outcome potential for. That's not something that we usually emphasize with you guys, but the inconsistency is the thing that the PAS is always reviewing for. So if you got into the habit of doing this, it could cut down on the number of times it goes back and forth. Close that. And I think that was all the things that I needed to cover. So I'm gonna pass it. Did you have, oh, you and Tree work together on the medications, that's right, okay.
Yeah, no, but Teresa.
Okay, here, so you need to log in and please stay in. Here you go.
Okay, that was very good. I want to let you know that we are going to do this every week. So you'll get an invitation and there'll be little tidbits that we will be bringing forward to you, tips and things that have been edited, adjusted. And as I said, this is a work in progress. You are part of the team in editing this and helping us make this customized for Livingston. So as you're going through Carrie Fission and you're doing your charting, and you have questions or things come up, please address those with your director, because that may be something that we request an enhancement for. It may be something that we are working on. It may be something we had no idea about. So you are part of the design team. So be sure you're bringing those things forward. Alex, there was a question in the room?
No,
Oh,
because
okay.
I need to make sure you put on-call north and south, weekend, different, because right now there's the only option, regular nursing visit and not weekend, some kind of different.
Okay,
But there's no option like after
Okay.
5 o'clock, after 10 o'clock, on call. If you work on call, you need to choose
service,
Yeah.
service
a
types.
new system.
Yeah.
Okay,
Okay,
we'll show you that.
okay, so one thing I want to show you all, I'm gonna go back to the homepage here. You might be seeing, this is this clinician's homepage. This is her schedule. When you log on, it automatically chooses you and it will show you what your schedule is. If you find that you've opened it up and you are seeing blue bubbles, that means that this visit has been completed and verified and sent over for payroll. That's all that means. You do not have control over that. That is done behind the scenes. Your job is to finish your note and complete it and sign it. And just as a reminder, in the left corner of the bubble, I'm going to click this show service description. This is going to make my bubbles bigger. In the left corner here, you can see a little piece of paper. When you click on that, it will tell you what's going on here. Completed service note exists. If you have a green bubble and you're not sure, did I finish everything? If you hover over that little note on the left, you'll know it'll either say completed or open. If it says open, you just click on that and it'll take you right to your service note. This is completed. This visit for this clinician is waiting for a behind the scenes verification. You don't have control over that again, but this is an important thing to do as you get towards the end of your payroll of the pay period. If your calendar is a 2-week pay period and you see some green bubbles, it's okay to bring that forward to your manager to say, hey, it looks like something's still hanging out there. We are doing our best to catch everything, but we want to make sure we haven't missed anything for your paycheck. Okay, so I'm going to head to a patient. I'm going to choose the patient named Ellington. You can look up a patient right here. On the left side, you can start typing a patient's name. And you'll find who you're looking for. You can also, from your calendar, click on a page, on a bubble, and it will bring up the patient. And sorry. Let's go back to home. Let's find somebody else here.
Oh, that's all right.
If you click on the patient's name, you get this box. This is where you go when you have an incomplete note here to edit your assessment. But if you want to go to the patient's homepage, which is what I want to do, you can go right here to view patient encounter, and that takes you right to their homepage. You don't have to type their name in. So that's a little shortcut on getting to the patient's homepage. And that's what this is. So quickly, this is called the header. Some questions came up yesterday, so I'm going to point a couple things out to you about this spot. Here you can see the patient's name right here. Here, just below it is the patient's phone number. This header has the doctor's name, the doctor's phone number, allergies, start of care. On the far side over here, this is a test patient, so it's not been completed. But on your active patients, you will see date of birth, age, if they're do not resuscitate, their disaster level plan. So this has a lot of information up here. On the profile tab, these are the tabs across the top. You saw these in your training. I encourage you, when you have a minute, to just open a patient and open each tab and kind of take a peek inside and see what you can see there. In this profile tab here, again, you're going to see the patient's name. And on the right here, it talks about this current encounter, the start of care, where the patient lives, referral source, and other information about this patient. The next tab is the contacts tab. This is also another place where you can see the patient's information. On the right, under contacts, you will find the family member's information or their caregiver, or, and in this case, we haven't added one, but this tab will show you that. I want to show you the clinical tab also. So Jamie mentioned when you are for hospitalization, for example, and you find out that your patient went to the hospital. There's a couple of ways that you can look to see who's involved in this case, because I need to send them a note. You can jump here to the clinical tab, and this is the clinical team. You see a case manager, you see other people who are part of the team, who are on, there may be other members here. This is where you can see. Another quick look, if you have a hospitalized patient and you want to tell everyone something, you can go right up here to this scheduling tab. If you click on it, it will give you the patient's schedule. So you saw before that it was Leslie's calendar. Now that I'm in the patient's chart and I click on scheduling, this is the patient's calendar. So you can come here and you can see who else is scheduled. It looks like this patient has some disciplines that haven't been assigned yet. They're expecting speech, OT, a chaplain, there's a nurse. Normally on your active patients, these will have patient names. If you hover over any bubble, it's going to show you the name of the person. So it looks a little abbreviated, but if you hover over it, it will tell you who it is. So this is another way you can find out who is seeing this patient. Who do I need to click and tell them something? Okay, now I'm going to go back to the patient's main chart. I did that by clicking on her names. And now I want to show you a couple things. I want to talk to you about orders. Some of you have been taught how to put in what we call addendum orders or additional orders. Not everybody has learned this. Don't worry if what I'm saying to you is, oh my gosh, I haven't learned that yet. You will. This is a slow rollout, and there's individual training and also continued training next week on how to write additional orders. But if you are a person who has written an additional order, I want to remind you about signing and locking that order so it can go out to the doctor for signature. And here's how you do that. So in your orders tab, this is a list of all of the orders. Here's this patient's 485, still being worked on. But there are some addendum orders that were written. This first one is in the saved status here. It's for, I can see that it's for an OT, and I can see that Leslie wrote this order and the physician, but it's in a saved status. In order to get this to the doctor or for medical records to send it out, it has to be signed and approved. And here's how you do that. When you write an order, this is what it will look like. From this screen, after you write your order, you need to go down to the bottom left and enter your signature. In this case, you can see Leslie's name is typed in here. It's been chosen from this drop down, or it defaulted in actually because she signed on. You could pick anyone, but putting a name here is not signing it. You need to click this orange enter signature on the left. Leslie, accept. You will now see this has been signed. Step 2, go to the right. You will see another orange link called edit, enter approval signature. Click on that. Accept. Now I have a signature on the left, signature on the right. The last and third step is clicking this approve button. So when you're signing an order, it's left, right, right. Sign, sign, approve. Sign, sign, approve. Now you can see my order here is in an approved status and it's ready for medical records to send to the physician. I'm going to do another one. Yeah, I will, but I'll do this the other way. One thing I want to show you too is if you're ever looking through here and you see an order and you say, look this is weird. Who wrote this order? Anytime you see a little yellow box with a red or with a blue dot, it says status history. Anywhere in Care Efficient, when you see this, if you click on it, you can see the history of this document. So it will show you with date and time stamps, who wrote it, who saved it, who approved it, who looked at it. It will tell you everyone, it's a history of this document. It's archived. So in this case, I cannot tell who wrote this order because there's no name here. So if I click on this little dot, I can see, oh, okay, I see Leslie wrote the order. It's in a saved status. I'm going to the pencil. When you write an order, you can do all this in one shot. You don't have to go back to the orders tab with the pencil. Here's the order. There's no name down here. There's no need to type your name in when you are logged on. I'm logged on as Leslie right now, and if I click enter signature, it defaults to her because it thinks I'm her. I'm accepting. Left, sign, accept. Right, enter approval signature. Accept. Approve. And you're done. Now it's in an approved status and medical records will send it to the physician, okay? So remember that. You're signing and you have to sign. You can't just type your name. Left, right, right. Sign, sign, approve.
And the reason this is so important is that there's, 90 clinicians at Livingston who are writing orders. If you guys don't personally get them to the approved status, us finding them is a bit of a challenge. So, and we need these orders to go out to the doctor. And, that's usually for important information that we're sending the doctor an order. So unless it's in approved, it's not going anywhere. It's just sitting in Care Efficient and no one knows anything about it. So that's why Tree's putting so much emphasis on getting it to the approved status, because currently we have quite a few number of service notes and orders and 45s that are kind of sitting there and no one knows exactly yet where they are and what we need to do. You have a question now?
Yeah, I have a question. Because of this is a new system, what's your preference? If somebody needs to create the order like extra PRN order, do you prefer if I call supervisor or in request supervisor to create PRN order, or I may create it?
So when it's a Medicare patient and we're going to be adding additional visits,
Yeah.
I
for any
would like
PRN
you,
visit.
I would like you to call the PAS
Okay, yes.
and they will put that in for you.
Okay, good.
And they will track it and they will make sure that it comes back.
Because of
If
this
it's a
system,
non-Medicare patient that needs authorization, I think you should call either Cheryl or Antonio, depending on where the patient is. And they will enter this and we will make sure that it's tracked and that we will get authorization.
Okay,
Yeah,
So-
show, oh, go ahead.
When we sit with you and we go over orders and how to put them in, and some of you already know how, and obviously that's why we're doing this piece. We'll elaborate a little bit more on that piece, but again, to emphasize Medicare, and even if it's a third-party payer and it might need authorization, if you write an order for a PRN visit, enter it and go, we may or may not have authorization for that. So there's a little conversation that needs to happen when you get an order and you need to enter a new frequency.
So that's specific to, like Tree said, adding frequency of visits. But there'll be other orders that you guys will write that you will do. And that's what Tree's going to show you, like for medication. That's something that you can do yourself and you don't need to call a supervisor or PAS.
So one thing I want to let you, those LVNs and PTAs that are on the call, when you enter an order, if you've entered an order, you will be just signing on the left because by the nature of your license, somebody needs to sign off for you. So PTAs are signed off by a PT, LVNs are signed off by an RN. So if you're on the call, LVNs and PTAs, you will just sign on the left. That is the end of your job. If you are any other discipline and you are writing orders, remember left, right, right. Okay, one thing I want to show you now is a little thing that's been coming up, and that is properly exiting these order documents. So I'm going to just open this 485 because it's not locked, it's in a safe status. At the bottom of your orders, you will see options here called save and close, save and continue. It's very important that you choose one of these. Save and continue will save your work and keep you in the document. Save and close will save your work and exit the document. If you come into a document, into an order, and you're writing or you do something, and then you just back out of it up here with your arrow, or you exit without using the save and close function, you will lock that order down. Nobody else will be able to enter that. If you're going in and you're trying to look at something and it shows up on the top of the screen that it's locked, it will tell you it's locked by somebody. There's two reasons. One, either that clinician is in this document charting, or they have exited incorrectly. They didn't push save and close. This is to help prevent anybody else from going in and crossing over your documentation. In McKesson, we used to call it collisions. You may have heard of that conversation. There was a collision. If Jamie and I were in the same document charting at the same time, it took it and then it said, who's the winner? And of course, I was always the winner. But there could be a collision. Carrie Fishit makes that so that it doesn't happen and it saves what you're doing. But remember, when you exit a document, and this is also on your service note, if you're not finished charting, it's on the top right. It says save and close. You want to look for the save and close function. Okay, now I'm going to show you something in medications. Let me just pop into the chat box really quick and see if we're having any posted questions. And if you do have a question, we'll have a little time after this meeting to answer those. So you can just type it in the chat box. We have no questions, and thank you everyone for staying muted. That helps the sound quality. So I'm now in this patient's chart, and I want to look at medication interactions. I'm going to go to this meds tab. This is going to list my patient medications. At the bottom left of this page, it will show all drug-to-drug interactions. Major, moderate, and minor. This patient doesn't have any minor. Our policy is that if there is a major drug-to-drug interaction, you must notify the physician so the physician can make a decision on whether or not they want to continue those medications or make a change. What I'm going to show you is how we show that we have sent this information to the physician. So this is going to be important for all of you to do. We'll do it a couple times. So on this patient, I've entered my medications. I'm looking over here and I see, aha, there's a major interaction with the warfarin and the aspirin. I go to approve medication profile. And this box comes up. I choose my name. In this box. Actually, you know what? I'm gonna have you not type anything there because I'm gonna try to save you a step. Put your name here. You can put a comment here, but you do not have to. Disregard this enter approval signature for now. Remember, I know it's drilling into your head to always click on this orange thing, but leave that alone for now. So on this page, interaction, approve medication profile, choose your name, and then create interim order. This effective date is going to default to today or the day. If you're doing this, let's say you entered your medications yesterday, you might want to back that out to yesterday or the start of care. You can change this date. Anytime there's a calendar, if you click on that, it's a lot easier to navigate around. You can type any date in anytime there's a date, but if you see a calendar, that's much easier. So make sure this is the effective date that you want it. When did you order these meds or when did you put these in? And then you create an interim order and save. Okay, now I just created an interim order. Interaction, approval medication, send interim order. Now I go to my orders tab. And you can see down here, I have something called a case communication. And it's in the saved status. It's major drug interactions, that's the information. I'm going to go to my pencil and treat this just like an order. In this tab here, where it says major drug interactions, here is where you will type for your review. This will then show up, and I'll show you what it looks like when the physician gets it, but major drug interactions for your review. You can type anything you want in here. You could say, call me, please approve, anything. But if you just type major drug interactions and add for your review, just like an order, you're going to come down here, sign on the left, approve on the right, click the approve button. Same thing, left, right, right. Now I'm going to go back to my orders tab, and you can see this case communication here. This is the major drug interaction. It's now in an approved status, and it is ready for the medical records department to send to the physician. And this is what the physician will receive on their end. This little printer tab is allowing me to open it up as a PDF here, so you can look at anything you want that has a printer tab in Carry Efficient. If you click on that, you'll get this, and you can print it if you like it and you want it for some reason, or you can just look at it. So this is what the physician is going to see. It's sent to, here's the doctor, here is the patient, and here is the mention. There's a case communication note, a major drug interactions for your review, and it's these two medications. And here is who has signed it. Down here, the physician, it says for your review only, so that it is not necessary for them to sign it. When this goes into a physician portal, and we're encouraging all of our doctors to be in a physician portal, they will be able to sign it electronically and it will come back. But at this point, you have done your job. You have sent this to the physician. You've shown that you have sent the major drug interactions, okay? I'm gonna do it one more time. In your meds tab, we'll just do the same patient.
just as Tree's showing you this, it only, you probably have noticed, but it's only automatically just gonna pull onto this, the major drug interaction, just like the moderate ones don't go, just, it knows automatically just to do it that way.
And thank you for bringing that up. Something else I want to tell you is that you'll notice here, there is 2 moderate interactions, but it's the same medications. It's not a mistake. It's different interactions. And this little icon over here, if you hover over it, it'll tell you everything about these 2 medications and what this interaction is. It will give you sources down here at the bottom. It's a lot of information. If you hover on the next one for the same 2 drugs, it has a different interaction. This is where you can go and you can, it'll talk to you a little bit about what those interactions are to help you with your teaching. Up here, by the way, in case you haven't learned this yet, when you click on the little yellow triangle, this also gives you warnings and things that you might need to use to teach your patients about on those drugs. And then the little, I'm not sure what that is, a flower or a splat. It talks about food interactions. So this is important for your teaching.
The part in the
These 2 here.
that Tree first showed you on the bottom with that little, icon there. What I've noticed and other people have noticed is the area there where it says discussion, like where Tree's cursor almost is right there, discussion. That seems to be more the language that we would use to talk to our patients about. The above information, the patient management, when I was speaking with the different nurses, was the discussion was the part that felt the most pertinent to what we would talk to the patient about. You guys can look at that a little bit and see, because obviously I don't think you can go through that, all of that document with your patient. So the discussion part, I think, is the most pertinent.
Right, so that's a lot of information. It's a little
A lot
tricky
of
to find,
clinical,
but the discussion is in all caps. You can look there. The yellow warning sign is another area where it has patient education, and then the orange flower is specifically about food related to interactions with this medicine. So there's a lot of teaching material right here on this tab. Okay, I'm going to jump back to interactions. Every major drug-to-drug interaction needs to be reported to the physician. I see that down here on my left. Major interaction. I want to send this to the doctor. Approve medication profile.
and again, this is something clinicians can do. You don't need to call your PAS or your supervisor to do this for you, because it's very simple and straightforward. And
Enter my name. If I need to adjust my date and mark yes for interim order and save. I've now just written what's called an interim order. I'm going to go to my orders tab. It sends to the doctor as what's called a case communication. You can see in the saved status. I'm going to go to my pencil. This is the edit pencil. And my case communication is going to open up. I'm going to type major drug interactions for your review. I'm going to sign on the left. I'm going to sign approve on the right. And approve. Okay, so I think I have probably drilled that into your brains enough. So I will now move on to, and you'll be happy to hear the last thing I'm going to talk about. And that is called directions and mapping. So I'm going to go back to my homepage. This is something that you should really consider doing at the end of your day. After you've seen all of your patients and you're finished, you're not going to see anybody else. It's fresh in your mind where you went, who you saw. You can't do it at the end of the day. It's not really a huge problem. Do it the next morning, just when the information is fresh in your mind. And I'll tell you why. On your homepage, on the bottom left, you see in red some action items. You want to click on directions and mapping. This is how you are paid your mileage in Care Efficient. So this is an important piece for you. This is your money. So you want to do this. Directions and mapping. Directions and mapping will take you to this screen. It'll default to you because you've logged on. And right here, the date, this is important. This defaults to the next day. The concept behind that is this is all based on your schedule. Remember, you're on your homepage, you have that calendar. So for the 29th, this particular clinician actually doesn't have anybody scheduled. So you want to change it to the date that you're looking for. And I'll backtrack for 1 second. On your homepage, you should look at your day. Does this look correct? Does this look correct, whatever the day is? Maybe this is my day, and obviously there would be more, but I look before I start my day, and I'm like, you know what? I'm not seeing this patient today. I'm seeing this patient tomorrow. So at the beginning of your day, when you're setting things up, if you know that that's really not the right day, or you've called them and the visit needs to be changed, you obviously are going to be talking to your scheduler. But you can drag it off of the day. You just click on it and drag it off of the day. Now, I don't want you to willy-nilly just drag patients all around off of your calendar. You have to communicate with somebody because the schedules are being created. So it's important for schedulers or whoever you communicate with regarding your schedule is a part of this if you're going to move someone or you want someone moved. But if you can make sure your day looks correct before you go to directions and mapping, that's one less step you have to do.
I didn't move it yesterday. Can I move that patient back a day? Because I saw them yesterday, but they were scheduled for today. I gave Kathy my schedule for the whole week. And
So if on yesterday, you discovered that you wanted to see the patient yesterday you would have moved it.
yeah, but can I move it today? Because I didn't know what to do with it yesterday. I just went and saw the patient.
So you're wondering if after the fact you can move it back?
From the 15th to the 14th?
Yes.
Where are we though? You have to be.
No,
It'd be the 27th to the 26th.
Yeah, well, yeah, I mean, it would be from.
It'd be great.
So
it would-
here's the
It's
situation.
Bartlett, actually.
If you have opened a visit, in this case, there is a little, you can see this little open service note, you cannot move it. Because you've opened a service note and you may.
Yeah, I didn't do anything with
So
it.
let's
It's
use Bartley Tree, because today is the 28th,
He's talking about.
and he's talking about, actually, is
Which
it?
I'm talking
Yeah, Bartley was moved.
That one, we
Yeah.
actually saw yesterday.
I saw
Can you move
yesterday.
that?
You just click it
I'm
over.
not sure if you, yeah, you can. But, and before Tree goes into the mapping part, Tree was talking a little bit about like the morning of to make sure your schedule looks good. But at the end of your day, when you're gonna do your mapping, you wanna go to your calendar and make sure the patients that are on the day that you are planning to map for are the patients that you actually saw for that day. It just eliminates a step. So if today was April 1st and I'm gonna go do my mapping and I look to see, okay, who do I have on my, who did my calendar say I was seeing today? And it has those 5 people or whatever number there. And before I go and do my mapping, I realized, oh, I didn't see Queen Donkey today. I'm gonna actually see her tomorrow. I'd move her to the correct day. And then I would go start my process of doing mapping and directions.
So even though there's an open note, service note, she hasn't put a time in and time out and completed it, so it's okay. So I'm gonna move this one back. I'm gonna move forward, and any individual questions about this, I'm gonna direct you to your supervisor. and you can talk through it. So we just moved
Yeah, I just
Philip's
thought it
visit.
appropriate, right?
But again, the way that works is the computer won't let you. So if you try to drag a visit to a different week, it's not going to allow you because it's in a different week. So it says right here, service day must be between 3/28 and 4/3. That's this week. So it's not going to let me just drag it to the next week or to a date that's outside of the cert period or a date that doesn't fit with the order. Okay, so let's get back to directions and mapping. You've looked at your list at the beginning of the day, the end of the day, I'm on my calendar. Yep, I saw all these people, maybe not in this order, but this is who I saw. You're gonna go to directions and mapping. If you're looking at your visits and something doesn't look right, you saw someone who is not on here, or you weren't assigned, or you're having trouble, call in. Don't spin your wheels and try to drag and drop visits. Just call in and somebody will help you get this right. It looks right to me. I'm going now to the left side, directions and mapping. This defaults to tomorrow, but I want to look at today, but we're going to pretend today is 4/1. I'm going to change my date. And now all those patients I saw on my calendar are now here with an additional 2 addresses here for home and home. Now, when you log in, the first visit of the day here under number 1 is going to be your house. This is going to be your actual address. Your address is protected and secure. So the only people who will be seeing your address is you or the administrator. So I just want you to know that this isn't out for everyone to see. This we're just showing you as an example. And so we opened this up so you can see how this works. But again, when you go in, your home address is protected and secure, so that's not out there. So the computer defaults to your home because here's the assumption. We think that you are probably getting up, logging in, calling patients, maybe doing a little work at your house before you head out for the day. So that is where you have started work. So mileage will be paid from your house to your first patient. If you get up and you've set everything up and you head out the door and you go straight to your first patient, then you would want to remove this with this little trash can because you didn't start at your house. You started at this patient's house. Maybe you are a person that comes into the office first. Lots of people drive to one of the offices and that's where they make all their calls and that's where they make their visits. You would want to change your first position to the office and here's how you do that. This little green plus allows you to add addresses to your day. In this case, this drop down up top, right now this lists your home address and all the offices. It is evolving and it's being worked on. This list will also start to include all of the labs and hospitals that you might be dropping labs off so that you'll just be able to go up here and choose a set address. In this case, I'm going to say I started at the office in Ventura. If you go down here and just click this little button, starting location, that's where I started my day and save it. It's going to default in as your first starting spot. Okay, then you need to look at these people. Is this where I saw? Oh, wait, I actually saw Morrison first. You use these up and down arrows over here to move the patient. Okay, up or down. I saw Morrison and then I saw Flannery. So I'm going to move Domke down and I'm going to put these people in order. Let's say after I saw this patient, Flannery, I did a lab. Where do I put the lab when you want to add an address? You come over here, so it's after Flannery, it's the next spot. So I'm going to add it. And in this case, because we don't have all of the labs programmed yet, you're going to have to type this in. We're getting you all a cheat sheet so you have addresses. Eventually all the addresses will be in. But I'm going to put that I went to the Quest Lab in Camarillo. And I'm going to put the address. Oops, my hands are off. Okay, and then I'm gonna save it. This is not a starting location or an ending location. It's right in the middle.
Mhm.
So I don't click either of those. I click save. And now my lab visit is here. Okay. Okay. So here is a question that came up yesterday. Let's say that this patient, Flannery, I go there, I draw labs, I start the IV, then I take them to Quest, and then I go back to Flannery's house to discontinue the IV. You need to hand enter this patient's address. Okay, you would do that by after the Quest. I haven't tried that. And then you would have to add that person's address here. The reason why is because if we created it on your calendar, then it's gonna be like 2 visits. This is not 2 visits, this is still 1 visit. But you did something at the patient's house, you drove to the lab, and then you drove back. So we would have to add that patient's address in right here and enter it. Okay? So you're putting everything in order. Where did you start your day? And then it defaults to your home address at the end of the day. The reason this is here is because there is some assumption that you may have gone home after your last patient and continued to work. If you continue to work, then you need to be paid for that mileage. So your home is the last spot of the day. If you went to the office and finished your day, you would go in here. You would choose the office. And then you would mark it your ending location and save it. Now it's gonna put that as last. So I didn't go to my home. I'm gonna trash can and throw that away. So that's gone. Okay, so I started in the office and I ended in the office. Or, oops, I didn't start at the office. I'm gonna trash can my starting location. And I'm choosing my house. That's where I actually started. Drop down, choose my house, starting location, and save. Okay, so you just want to look at this, use your arrows to go up and down to put your day in order. And the reason we say do it at the end of the day or the next morning is because it's fresh in your mind. Think about 2 weeks from today, trying to remember the order that you saw patients. That's going to be a little tricky. The computer does not look at your time in and time out from your service notes, so it can't tell where you went first. This also is not reliant upon you completing your service notes. So you can go in and do this at the end of the day, even though you haven't even maybe completed all of your charting, it's still okay. Just get this one, make it part of your routine, get it done. These are your miles that you need to be paid. Okay.
I just want to give the example if, and Tree vaguely touched on it, but let's see on patient 6, Princess Moran. That was your last patient of the day, and then you're going to meet friends for dinner. And you're not doing any work. You finish with Princess Moran and you're done for the day, and you're going to start your day tomorrow morning. You would not get paid then for traveling either to the office or to your home, because that isn't what happened. You actually finished your work at Princess Moran's house for that day. So then you wouldn't have, you'd make Princess Moran the ending location. And then you go in and you hit, you're gonna show them the save part, this one.
Oh,
Right,
right, directions.
Yeah,
Yep, so this is my day. I ended it here, and then I will be after this, I'm gonna talk about McKesson and mileage, because I know you're just dying to know about that. So I will tell you that in just one moment. So I've entered all of my extra visits. I put my lab in here, my Camarillo lab. I finished my day at this Moran's house. Then these steps are very important. So I'm gonna say it a couple times. You put them in order. You need to click get directions. Step 1, get directions. And then you need to step 2, look down here underneath this red mark. It will show you how many miles you drove. This is 80.5. You need to just kind of eyeball that. You don't need to know for, exactly, but does this sound right? Another place you can look is over here. It's going to tell you how many miles you've driven. If all of a sudden there's like 200 miles, or down here it's you drove 500 miles, something's not right. In some cases, addresses have been put in just slightly incorrectly, and it has, or maybe a zip code. And we've had some cases where according to mileage, the patient or the clinician drove to Sacramento and back in one day. And I said yesterday, that's a fun, tiring road trip, but I'm pretty sure that you're not doing that. So if that happens, you need to bring this forward to your supervisor or your director, because something's off with these addresses and we need to fix that, okay? So I've clicked get directions, I've checked this out, that looks right. And then the final step is save. If you don't save it, it doesn't go over. Okay, so put them in order, get directions, save.
And just remember to put the day that you're actually doing in that calendar, because it's going to default to tomorrow's date. So you have to remember to go back in there and make sure you're doing today's date.
So we can go back to the beginning of this pay period and.
Yes.
Yes.
And let's say that I did this at the end of the day, and then all of a sudden I was like, oh crud, I forgot about that last visit. They called me and I did a visit on my way home, but I didn't chart on it yet. You can go back in and add and put the people in order, and then you can save it. You can do this all the way up until the Sunday or the end of the pay period. We're just saying if you do this now, it makes more sense. It's the hospice team has learned this, and they have learned by trial and error that if they waited, they spent, a half hour or more trying to remember what the order of their visits were. So you can go back, but just make it part of your habit to do it at the end of the day or the next morning.
And the easiest way is to make sure your calendar for that day matches, because that's going to then automatically populate this. You don't have to then do as much if your calendar is correct here.
Correct.
Then when you go to directions and mapping, exactly what's there is what's going to show up.
So in this case, on the second, you can see this clinician is only assigned to this one patient. So if I go to directions and mapping, I choose the date of the second, it's going to default to starting at home and ending at home, and then that one patient. It's all built from your calendar. Okay, and if this was true and this was the case and this was the right order, I would click get directions. I would check down here, 5 miles, that looks correct, and then I would save. Okay, now McKesson. McKesson pays mileage from your home office to your first patient, from your last patient back to your home office. Right now, when you are seeing patients in both systems, you will be paid mileage out of both systems. There is going to be a little bump in your mileage pay on your checks because you're getting basically sort of double miles. Once we hit the point where more of our patients are in care efficient than they are in McKesson, and at that point we'll talk to you, that's when we're going to start entering. Maybe you did all care efficient patients and only one McKesson patient. We're going to have you enter that McKesson patient here. In a couple of months, everybody will be in care efficient, and then you'll be back to doing just mileage here. The McKesson mileage, you don't have to do anything. That's all automated, and it looks at your time in, time out, and it maps your route for the day. In care efficient, you do have to go to directions and mapping, and then put your patients in order. Okay, are there any questions on mapping and directions? I don't see any questions in the chat box.
And look in your emails, because there's going to be an invite for next week. As of right now, we believe we'll do it Tuesday and Wednesday again. It hasn't been finalized, but just look at your email. It will come from James, and then your director will send you a click to say, please look at your email. The Zoom invites are there. We're going to try and do this once a week. The next ones, we really will do our best to keep it to an hour. But I think we cover valuable information, and each week like next week, we're going to cover something on orders and hospitalization.